So it's great to be here today. When Jeff and actually Patty Riley reached out to me last year, I said, what would you want me to present to this group for? Never been here before, although I've heard of the thought leadership that comes from this group, and you just can't say no to Patty, right? So here I am. We talked about, what I should be addressing in my remarks, and Patty said, please come and participate and learn. So I was really thrilled that I was able to spend yesterday here. And last night, I feverishly sort of rewrote what I was planning on addressing today. I learned so much yesterday. And, it really is helpful, I think, to go to a conference or a convening where it's not your tribe. So, this is, thank you for inviting me. I learned a lot, and I would recommend that maybe you attend something, in the next year or so that is, related to what you want to learn about, but also maybe not the people that you usually connect with. So a little bit about myself. Thank you, Jeff, for the introduction. I've been with AONL AHA for almost 5 years. Prior to that, I was a nurse leader. I think the Philadelphia area is very well represented in this conference. I worked for 35 years at AtlantiCare Health System in southeastern New Jersey, the last 20 as chief nursing officer for the system. Prior to that, I had started my career in Massachusetts and a little bit of time in New York State, where a maternal child area was my clinical love. And I still, when I go to the labor and delivery areas, when I tour, or the NICU, it pulls at my heartstrings, because that's really where I love to be. So I did work labor and delivery, postpartum, NICU, worked in a prenatal clinic for a while. So I kind of had the whole scope, did a little stint in peds, and had the opportunity to interact with anesthesia professionals. So, I think I know a little bit about your world. So I am going to make sure I understand this technology. Yes. So I'm going to talk mostly about workforce, a little bit about the remote provider experience, and then I guess I just would like to end with, with a little bit about my observations from what I've learned over the past day. So here, and I might have to put on my glasses because the slide is. I thought I brought them. Yeah, I did. The slide looks tiny on this little screen. Massive pressure on the healthcare workforce. By the way, I have way too many slides, and you're welcome to them after, and I'm going to buzz through a few of them. But we know that the last couple of years has been absolutely devastating. And thank you for making them bigger, as I travel the country, which I do pretty much for, in this role for my job, that's what I'm hearing. I hear it from everyone, not just nursing leaders, but we're hearing it from, all members of the C-suite, from the nurses and providers, and it's really a challenge. Compounding that, the past 2 years in particular, are the health system financial pressures. And for sure, there are the haves. We know about the health systems that have lots of resources and, not just a year's worth of cash on hand, but way more than that. But we also know, and I know personally, the critical access hospitals, the rural areas, the community organizations that really are worrying about payroll pretty much month to month. So it really is challenging to do the work for the future when you're really immersed in the day-to-day. So we know that the workforce issues, are exacerbated now, but we've known about these for a while. And as you can see on the screen, some statistics that are a little bit older, but just goes to show you that pre-pandemic, we knew, baby boomers are retiring, and, we knew the cyclical nature of our business around workforce, and we were making preparations. However, we know that, the pandemic just ripped the Band-Aid off and created challenges like I've never seen in my career, and I'm betting that pretty much nobody in this room has either. So we can see prior to the pandemic and then numbers with the pandemic that the hospital staff turnover rate, that's all staff, has really increased. We haven't gotten the final 2022 numbers yet, but when we do for nursing, and when we look at the average RN vacancy rate, that's a tough one. So in 2023, we've seen a little stabilization of this, which I'm happy to report. But again, it's very regional. Some organizations have, we're going to talk about contract labor in a little bit. Some have really reduced their utilization, have been able to, to shore up their regular full and part-time staff, and others are still struggling. So here's just a very interesting perspective too. Our nurse managers, our frontline nursing leaders, have huge responsibilities for running their units, worrying about outcomes, worrying about the well-being of their staff, and also their, patient satisfaction, budget, you name it. Usually there's a small number of new nurses that they're, onboarding, making sure that they're shepherding into, becoming competent nurses. But if we look at the staff, the tenure of nurses, of frontline, 12-hour shift working nurses is really scary. And I know from my conversations with, my colleagues that we have nurses precepting that are nurses for, less than 2 years. And they're now the preceptors of the new nurses that are graduating. So, and education has really been challenged in the last 3 years. So the nurses that are graduating, the level of competency that we expect with them is really not what we are finding. And that is not just for nursing, that is a worldwide statistic right now, that folks are graduating and are not as well prepared for any job as they are, despite the fact that they do pass their NCLEX exam. Now, the next slide talks a little bit about the Great Resignation, and this is for all sectors. It is not just, healthcare, but it does include healthcare. And we know that many folks in the workforce have really reevaluated their life. And do they want to switch careers? Do they want to reinvent themselves? We're seeing still lots of gig workers. Folks are saying, I don't want a full-time job. And, especially, when we see some of the financial benefits in healthcare of people, traveling, it's hard to, for the folks that really want to maximize their opportunity to earn, it's hard to really have an argument. I've heard this week that, and I don't know if this is politically correct to say, but sign-on bonuses for CRNAs are approaching $100,000. So, I mean, that's just pretty unbelievable. Staff nurses too, $25,000, $30,000 sign-on bonuses in some areas. It's really pretty amazing. And we saw lots of people leave the workforce, and I think I have a slide later on that shows that particularly the 55 and olders left the workforce, and we're really not seeing them come back in the numbers that we had hoped. So, we know that we are faced with generational, we've got now 4 generations in the workforce, but the things that Generation Z healthcare workers want seem pretty, from my perspective, and obviously I'm a baby boomer, but they seem pretty reasonable. They are comfortable with technology. They want to work for places that really do embrace technology and have the latest and greatest. They want work-life balance. That is very clear. Greater access to mental health support. The stigma that some of us older healthcare workers maybe feel about seeking behavioral health does not exist in our younger workforce, which I think is a good thing. They really value diversity, inclusivity, and belonging, and have a strong sense of social responsibility. So all good things. Sometimes I think that, we bemoan the work ethic of the younger generation, but you know what, maybe they have things, pretty well thought out. Younger and older workers are decreasing, as I referenced earlier, and the younger workers, we know from a wage perspective that, you can work at Walmart, you can go work at Target, at, Southeast, from my area, it's the Wawas and the 7-Elevens. And, that might be deemed to be a lot more pleasant work than entry-level hospital work. So we really have to work on that, and that's one of the things I'll talk about in a little bit. The next slide, I think, is probably one of the most important slides that I have for you all today. And it's not just about demand or supply, it's also demand. So by 2030, all baby boomers will be over the age of 65. Ooh, I just can't believe that. And the younger people in the room are probably like, yes, finally. But this is, pretty startling. And the last bullet point, the population of our super seniors, 85 and older, is expected to grow nearly 200% by the year 2060, right? Yes, can't see it too closely. So we know the care that our super seniors require. When we look at our hospitals today, our nursing homes, I mean, who's it filled with? It's filled with, our seniors and our super seniors. So the demand that's going to place for healthcare workers is really, huge. So, despite the fact that we're seeing care migrate outside of the hospital walls, which I think is a positive trend, I think our hospitals are still going to be pretty darn full as well. I think the jury's out about remote work. You may have read over the last, especially couple weeks, that the tech companies are saying you got to come back to work, including Zoom, which I think is pretty funny. Also, the financial institutions, JP Morgan Chase, all the heavy hitters are saying we want our people in the buildings, and yet there's a lot of pushback still. Many healthcare organizations basically said we are allowing those, during the pandemic, they said those that are back of the house, we are, going to send them home and they don't need to return. And I know there's a lot of organizations, billing and coding and a number of other functions that, do not occupy hospital property anymore. We know that some of our healthcare workers are also working remotely. We're going to talk about virtual care, virtual nursing in a little bit. We're not sure about, I think the pendulum is still kind of out there, but what we do know is that in healthcare, we're competing with those industries that have said, okay, there's more flexibility to be had here. I know there's also questions about productivity, and we have a little bit of mixed messages here. So I think the jury's out, but I think it's something we really need to watch. Top 10 patient safety concerns. Every year, ECRI produces a list, and I know yesterday we heard from, the chief medical officer from ECRI, but in 2022, we saw staffing shortages really top the list. And this year, the issues around, workplace safety and workplace violence really are, very disturbing trends and things that we see and hear across the country. I think we'd be naive to think that healthcare would be immune from what we're seeing in society and across the country. And, it's really, so concerning and so distressing. And if you look at the statistics, I think healthcare workers, nurses in particular, had 5 times the rate of occupational injuries related to, to their work setting than the average person who does not work in healthcare. So we need to do a lot of work in this area. Last year, ACHE did their annual CEO survey, and I think for the first time in many years, staffing was the -- challenge, workforce challenges. Usually it's reimbursement, as you would expect. Last year, it was workforce, with shortage of RNs topping the list, and 90% of our respondents responded in that way. But when you look down the list, it's really a shortage across the board. It's not just nurses. It is clinical folks as well as non-clinical. So lots of work that we need to do related to these challenges. And for some reason, I think the next slide looks like I have some duplicates, but and apologies here. But our AONL we have a longitudinal survey that's Actually, our 5th iteration will be going out this fall. And this is last fall's results. But we asked nurse leaders and had a really great response rate. What were their top 3 challenges? So it's their staff. They're worried about the emotional health and well-being. It's staff turnover. And in the beginning of the longitudinal survey, at the beginning of the pandemic, there were layoffs and there were furloughs. And so we kept the question the same, but it really is related to retention and turnovers. And the third is travelers, and our contingent labor still continues to be a source of real challenge for our nurse managers, and a number of other lists as well, a number of other items on the list, as well as we had a little bit of difference depending on your role. Okay, so every 2 years, the National Council of State Boards of Nursing produces a report. This year's report, which was released in the spring, is extremely concerning. 100,000 RNs left the workforce due to stress and burnout, over and above the normal number that we would expect to see leave, by normal attrition. This is a great report, by the way. This is just a couple, of line items, but I would encourage you to go to the original report. Very concerning, 610,000 reported their intent to leave by 2027. Now, intent to leave in all surveys related to workforce is never directly correlated to who actually leaves, but when you look at, what is the mindset of the nurse if we have 600,000 nurses that say in the next couple of years they want to leave? By the way, we have 4.1 million nurses in the US that are currently licensed, registered nurses, and we have about 2.1 or 2.2 million that work in the hospital setting. So a good half, a little more than half, still work in hospital and health systems, and the rest work in many different settings, including in industry. And I think we have some nurses here who are examples of that. Our younger nurses are especially distressed. We will see that in another slide coming up. Burnout, emotionally drained, et cetera, is very concerning. And 3.3% decline in the US nursing workforce, we've seen in the past 2 years. So this is something that we really need to keep an eye on. We need more nurses. We know that from the demographic information that I gave you a little bit ago with our, aging population. We can't afford to have nurses leave and nobody to replace them. Also, our nursing school enrollment, this is a study by the American Association of Colleges of Nursing. They put it out every year. Last year in 2022, we turned away 78,000 qualified applicants. Due to lack of faculty and training sites. But more troubling is that little red dot on the right-hand side of the screen. Our number of students in entry-level baccalaureate programs decreased by 1.4% last year. This is the first time in 20 years that we've seen a decline. So we had a real challenge, right before the year 2000, we had a couple years where we really saw a decline. There was a really big promotion. You may remember Johnson & Johnson's Image of Nursing promotion. There was a lot of money generated towards, supporting the nursing profession. And we see from the green bars that it really did have an impact. Also, that was the years, 9/11, which was 2001. There was a sense of renewed purpose towards the service professions, and we saw, and healthcare, and we saw, a pop. But we're keeping our eye on this because this is very concerning. Talked a little bit about burnout and mental health. My survey that I referenced earlier from AONL looked at our self-reported information from our different levels of nursing leaders. It may be no surprise to you. Our last survey in the end of the summer last year, early fall, showed that our numbers had improved a little bit, which was a good thing to see. We'll see what this year's show. But the nurse managers, those managers, leading our staff that really are, and I did that job probably for 3 years earlier in my career, and I can tell you it was the hardest job I ever had. So they are pushed and pulled in all directions. They're getting directives from above. They're trying to keep their staff happy. They also really care about their patients. I mean, it is, and the burden of staffing, I think their number one job, 24/7 responsibility. We can see that they say they are not, or not at all, a large portion are not emotionally healthy. So we at AONL, we are working specifically on this group of nurse leaders. Also, we see the statistics around physicians. Lots in the literature about burnout. We are also, AONL, NHA, working very closely with the Lorna Breen Foundation. There's lots of well-being initiatives that are underway, also with the National Academy of Medicine, but very, very alarming numbers. Our travel nurses, we've seen an increase, prior to the pandemic, and I've been around a long time in nursing and staffing, 7% was the usual number we would see, and travel nurses have a great place, to help us with our fluctuations. So in my role as nurse exec in Atlantic City, we would see our census pop every summer. It was predictable, all the shore visitors, and that was also the time when my staff wanted to take vacations because they live at the shore. So we would engage travelers every summer. They would love it. We knew them. They'd come. They'd supplement our staff, and we budgeted for it. It was wonderful. Great relationship with our travelers. So you have vacancies that a long-term medical leave, for example. You bring people in. I mean, I absolutely support the appropriate use of travel and, travel nurse and contract labor. However, what we saw during the pandemic is that, we had dramatic swings in nurses who would leave one hospital in a big city and go work across the street for, very significant increases in compensation. And we've seen a little bit of right sizing, and here I'll put the next slide up because that also addresses the cost. We've seen some right sizing, but I can tell you, particularly in the procedural areas, and you may all see this in the ORs, and I'd love to know by a show of hands how many has seen it stabilize, the travel nurses in your ORs. Anybody want to say yay, nay? A little bit? And how many still see tons of travel nurses? Yeah, okay. That seems to be the trend. The procedural areas, the EDs, in some areas and regions of the country, the ICUs, and there are still hospitals that have significant amounts of travel nurses throughout. I think cost is a real concern, but there's also the issue of teamwork and how many, if you're looking at your cadre of nurses and your team members on your floor, what's the appropriate number? Is there an impact on safe care? I mean, things like that are all things that are being studied. I think the jury's really out there, but boy, it really, I heard from a lot of staff nurses that were very concerned that the person who they're working next to is making 3 times what they are. And by the way, they sleep in their own beds at night because they only live, 45 minutes away. So sometimes really a real concern, from an equity perspective. So also know we see some contingent labor in other areas, not just staff nursing, but also, you name the profession, we see an increase in that across the board. So future healthcare workforce needs. If we look at these numbers, we know that alternative care settings is expected to rise in the next decade. Inpatient care, though, is also expected to rise moderately, not the rate that we're seeing in outpatient and alternative care settings, but still more settings means more people that need to take care of the folks there. Also, we are expecting to see a bump in the emergency department initially, and then, as this one study suggests, it levels off by 2032. Now, time will tell. We'll see. Some of that has to do with reimbursement, what our, as Lee said yesterday, if Medicare Advantage becomes the only way to access, there's lots of accountability that health plans may need to take, and they may drive our patients to different settings, but, we'll see. But what we need to do as healthcare leaders is really focus on what we're going to need for the future as well as what we need for now. So one great example that I never even thought was a skill set that we would need in the hospital 15 years ago was cybersecurity experts. And, when my CIO used to talk to me about cybersecurity and the fact that, they're contracting out and it's something to worry about, but it was very, very nebulous. I mean, now I think from what we're seeing around the country, hospitals are finding that they need to employ people who specialize in things like cybersecurity. So, I mean, who knows what the future holds? Technology, will also mean that people need to support some of the new technology. It's not just all about, platforms and gadgets and new toys. So, some key areas that we know now that, and what we're focusing on are, the interdisciplinary team. Heard that all day yesterday as well. It's not just about your profession or your discipline. It really is about the care that we need to deliver together. Leadership competencies that we probably, if we really look in the mirror, don't have right now. So change, not just change management, but change leadership, innovation. I'm going to talk a little bit about, my own perceptions, but of yesterday, but I think the aha to me was that, in sitting at the table and making decisions about huge purchases and not feeling in the past like I've had the ability to make the right calls. People are really gun shy about investing millions and millions of dollars, making decisions that will impact the care for the next, decade or more in their organizations without the appropriate skills and competencies. So we really need to look at what our leaders need for the future. Technology is a tool. I think we mentioned that earlier, and there's really no topic that we can talk about, whether it's practice, education, et cetera, where technology isn't an underpinning. So, education and practice really need to partner together. I know we have some wonderful examples of that across the country, but we also have community colleges in places that really have very little access to, to technology that we need for education. And, we're not islands. We really need to pull in community-based, education organizations, rather. We talked about social determinants. Now we like to call them social drivers of health. But, those things that we consider social services, in Europe and in countries across the world, that really is lumped into, the healthcare spend. So I think it's a little false sometimes when we compare our spend to those, other countries across the world, because many times they lump in their social services with healthcare, just saying. In the parking lot really is, the boards of nursing, the boards of medicine, the boards of every health profession, and how we really are siloed. And we're in protectionist mode. And is that really what's going to get us, where we need to be in the future? So real quick, I'm just going to buzz through some of the work that we're doing. Workforce is an important strategic framework for AHA. You can see here we have a now, near, and far focus. The way we've organized our work is that, we have initiatives underway that we want to have immediate impact, but also work underway that we know will take longer to actually bear fruit. And AONL and AHA are working very closely together. We have a board-led workforce group for both organizations, and they're cross-pollinated, and we're trying to do everything as integrated as we can. So here are our key focus areas for this year: culture of work, care model exploration, workforce planning, and messaging the healthcare career. And I just want to say a little bit about, we are inventorying the models of care that we saw spring up throughout the pandemic and post-pandemic. Most have a team-based element. They're interprofessional. The role of the virtual caregiver, i.e. virtual nurse, is, I would say, is usually included in most of these new models. The term virtual nursing, by the way, it's the Wild West. We are working, AONL, with ANA and other nursing groups to really define scope and standards for it, because, you know, we've talked where virtual nursing doesn't even have any nurses that are involved with it in some, you know, according to some folks, whereas, you know, on the other end of the spectrum, I think we also see, you know, nurses being used for just observation, which is really, in my opinion, you know, not utilizing them to their full scope. So we are evaluating with IHI through a grant from Johnson & Johnson, successful, scalable models of innovative care delivery. We are focusing initially on inpatient models, but we really see that that needs to expand. There's some excellent hospital at home models as well that are part of the inventory. And I mean, there's so much work going on here. The challenge is being able to critically evaluate them all and to actually just share the information. We have so many people working, you know, on things, and they're head down and they're not able to share. We are convening a summit with technology leaders in nursing next month, actually this month, September 19th. And we're collaborating on, as I mentioned, scope, standards, and competencies for virtual nursing. And what is the impact of AI? What technology can actually help reduce the workload, not just for our frontline nurses, but also for our nurse leaders. So that's just a little snippet of what we're doing there. Here, the next several slides just has more detail around those, you know, those areas that I mentioned. And, you know, one thing I just wanted to point out, as we look at hospital at home, it really became apparent to us too that here under, well, I guess it would really be under care model exploration, that we found that the issue of equity really did come up. You know, some homes were not safe for the patients, let alone the staff, to go and provide, you know, care at home. And so it sort of raised a question about, you know, we really do need to look at equity for our patients as, you know, they are being provided with care in the home. And, you know, we saw large demonstration projects for hospital at home, and we also saw some small ones. So that's work that's being evaluated as well. What I wanted to say about workforce planning is we have to plan for the future. Messaging the health career is important. When you do the research, kids in high school, if you're trying to talk to juniors and seniors in high school about a healthcare career, it's really kind of too late in many cases. We really need to start with the 7th and 8th graders. So some of the programs that we have seen success with across the country is getting to those younger kids, exposing them, you know, not just one day a year to come to the healthcare setting, but really to make it a more programmatic where they can really see what a career in healthcare is. And it doesn't have to be just, you know, clinicians or people touching patients. It really can also be, you know, what role IT has in the healthcare setting, or, you know, a number of other functions. So a little commercial here for AONL. We got nurse leaders from all over the country to participate on these different teams, and we have a great document that's available, and this is not just for members only, this is available for everyone. So if you want to, you know, to direct any of your team to our compendium, we would really, you know, I'd be happy to provide more information. What AONL specifically is working on this year is the role of the frontline nurse manager. We're working on the care model inventory, as well as, you know, our project with IHI, and also pulling together the technology that will be helpful to our nurse leaders. So I know I talked really fast, but here's just a couple observations that I had from yesterday. So, and this is my last slide. I think we all know, leaders, healthcare leaders, nursing leaders across the country know that healthcare in 2030 and beyond is going to look very different than it does today. but how do we get there from here, I think is the big burning question. Our nursing leaders in particular, and I think most of our healthcare leaders are working on head down on the operational issues. They are working on shortages in the workforce, the challenges with resources, with burnout, with workplace violence, with supply chain issues. And really the role of leadership is to be strategic and to really be able to look towards the future. Could I have my slide back, please? So I have, my notes. I think also the baby boomer issue is really a double whammy and something that we really have to prepare for because it's really impacting supply and demand. We are, I consider this group to really be thought leaders and to be, for the most part, coming from organizations that really do have resources that are able to support, innovative and creative roles. Not that everybody doesn't have financial challenges, but when we look at those other places that I mentioned, the rurals, the critical access hospitals, many of the standalone community hospitals, they're just almost paralyzed. They're, really concerned with the future, but they are immersed in the day-to-day. So, I challenge the thought leaders in the room to really not forget about, and to offer some guidance towards those other organizations because it's, it could be a different world than from where you're, you spend your, the bulk of your career. I hope you see how privileged you really are, and I hope you're not offended by that. Generational differences, they're hit, it's obvious in our healthcare workforce, but it's also, obvious that our patients, we're taking care of, multi-generation society and, a very diverse society. And we have that has lots of implications for us. I didn't get a chance to talk about it. I'm proud to say that I was really committed to, to my, in Atlantic City, to my schools in the 1990s, where I was able to offer, through my healthcare organization, scholarships and fellowships to kids in high school that probably never would have been even able to attend, associate degree school. They were able to become nurses. And, I still hear from them, and they've gone on, and some have advanced degrees. And I think we really have to, realize, as was mentioned yesterday, that it's a business decision. The ROI for inclusivity, diversity, and equity is there. It's very clear. So we really need to focus on that. I mentioned earlier, tech is really expensive, and leaders are so worried about not spending money appropriately. And so we really have to help them. When I think about the last iPhone I bought, it was right before the new one came out. I was so mad because, if I would have waited 4 months, the new one came out, and I would have had the last bells, the latest bells and whistles. And I think that that's just like one little example, but everybody wants the best, and, it's costly. Yesterday, and I'm going to do a lot more research on that, I so appreciated Megan's a presentation around implementation science, because we have really been focusing on evidence-based practice and evidence and evidence and evidence and evidence, and we really haven't thought as much about the components of implementation science that really might be the key to us adapting in a much more rapid fashion the things we need to get done. So, some of the things she talked about: target strategy to the context, bring all stakeholders to the table. Incentives may be different for different groups, but that's okay. Technology must be implementable. Workflow is paramount. That's why we can't get the front line to go along with what we are choosing, is because we didn't pull them in early enough, and we're making choices for them that's going to affect their everyday life. And we've got it all wrong if we don't think that they're important on the front end. I mentioned change leadership and innovation competencies, and I think my last thought was that we so need to reduce the burden of our caregivers as rapidly as we can. Speed is of the essence. If we lose more nurses, if we lose more physicians, frontline folks, I mean, it's just going to make it worse for the folks that are there. And then I think it's just a vicious cycle of who wants to be the last man standing or the last person standing. So I am not a pessimist. I'm going to end by telling you that my job, for the past almost 5 years, I've been traveling the country probably 60% of my time, with the exception of COVID when it was Zoom and Teams calls. And I have talked to so many young, eager, intelligent nurses, physicians, healthcare workers, and I have real hope for the future. My daughter I'm very proud of her. She's a trauma nurse practitioner. She loves her work. She always gives me the reality. I'll say, oh, I'll complain about the younger generation, and she'll say, Mom, and I'll hear the reality of what she's doing every day. And it's hard work. We all know that, but it really, speaking to our millennials, our X's, and our Y's, you name the alphabet soup. I mean, I think our future's in good hands in healthcare, but we just really need to realize that speed is of the essence here, and we got to fix the workforce problem. And so hopefully you will all join with me to commit to paying attention to this, because it's really important. So that's all I have to say. I'm going to hand this back, and I guess we go to panel? Yes. Thank you, Ken.